Does housework make you sick? I mean, actually physically ill. For many people, dusting and cleaning around the house can bring on a nasty fit of sneezing and coughing. But it's not just plain old dust that we're allergic to.
In West Palm Beach, this is Dr. Mark Stein. You can't see them, but within this common house dust are thousands of tiny creatures called dust mites. Brace yourself. Here's what a dust mite looks like up close. The residue they leave behind can cause allergic reactions, from stuffy noses and headaches to full-blown hay fever or asthma. Indoor allergies caused by dust mites are troublesome because we get no seasonal relief. Dust mites live in our pillows, blankets, carpets, and upholstered furniture. They're in our box springs and mattresses, all the things closest to our nose at night.
I mean, that is the dominant indoor allergen because all human dwellings that are particularly closed in, or like we do now with keeping the windows closed generally and recirculating air, are going to have dust mite. Their food source is skin scale. We all shed that, and so there's plenty of food, and if the humidity is right, they will grow. And so they do very well, particularly in Florida homes.
In Florida, both indoors and out, the weather can cause lots of trouble for people with allergies or asthma, especially indoors if they don't use air conditioning. Outdoor humidity causes mold to form. The higher the humidity indoors, the higher the number of dust mites. Ironically, humidity used to be recommended as a method to break up secretions in an asthmatic child, up until a few years ago. If an asthmatic child is allergic to dust mites, now we know using a vaporizer can do more harm than good.
Because that increases the humidity in the indoor environment and makes the mite growth go up way high.
Dr. Nelson discovered this in a study he conducted at the University of South Florida.
There's a high percentage of kids, especially asthmatic children, that have allergies or hypersensitivity to environmental allergens, especially those inside the home.
Dr. Nelson's study found that 90% of children tested between ages 3 and 16 reacted to dust mites. The kids' homes were tested, and researchers found between 2,000 and 10,000 dust mites per gram of dust in each of the homes. Fortunately, we now have medications such as intranasal steroids, which are inhaled into the nose to control allergies. Intranasal steroids belong to a class of drugs called topical steroids that are anti-inflammatory and anti-allergy. They should not be confused with steroids taken to increase muscle strength. Topical steroids treat indoor allergies very well because they concentrate primarily on the parts of the body where symptoms occur.
They're sprayed into the nose through a device which delivers medication to the area of need without much to the body. So you get away from the side effect problems of the steroid, but you deliver a lot of treatment to the area of need, which is the nose and the nasal passage.
Antihistamines, decongestants, and other kinds of anti-allergic nose sprays and allergy injections are also very effective in treating allergic reactions for many patients. But there is rarely anything better than limiting the actual exposure to the allergen. To limit exposure to dust mites, keep rooms especially clean. Throw bedclothes in a hot dryer before washing them. Then wash them in very hot water, at least 135 degrees. One of the things I always recommend for my dust mite allergic patients is to enclose your pillows, mattress and box springs in vinyl casings. This simple measure is scientifically proven to reduce dust mite exposure and helps you breathe a little easier. In West Palm Beach, this is Dr. Mark Stein.
In order to